Hello, and how are you? Welcome in our session on investment planning. My name is Winnie Barawa. If you're new, this is a channel that focuses on different lectures pertaining to healthcare or healthcare services. So, by definition, investment planning is being said to be a process that involves identifying specific financial goals and putting together a strategy to help us in achieving them. So the process of investment planning is treated as a type of strategic planning that ordinarily just takes into account various options that we might have and the effects that they may be influenced from macro environment. And here we are looking at the bigger picture of, let's say, governmental effects, political effects, technological effects, and so on. So from the process of investment planning, we therefore generate what we call an investment plan, which is a tool in the process of financial planning that is normally designed to help in investing strategies so that we can achieve financial goals. So the investment planning is the process that will help us get the investment plan. So further on, one might ask themselves, what are the components of the investment plan now that we are saying it's a tool? So an investment plan, some places when you read they call it business plan, although the components are a bit different, but the structure might be the same kind of in a way. So let's focus on the components of the investment plan. The first part of an investment plan here is what we talk about the introduction and background. So with the introduction and background, there isn't much that is written on this side apart from discussions on the purpose of the document, the results or frameworks, the role of the planning committee, that is the members of the planning committee that have been participating in developing the plan. And then what we call chapter 2 or level 2 of the components is the situation assessment. So the situation assessment will look at the current state of different aspects in the health or the current states in the different aspect of what you're planning on. So focusing on healthcare, what you will bring on this chapter is the health status in the country based on the demographic characteristics, maybe age, the population's character, like the men or women. Generally, you talk about the health status in the different aspects of demographs. Then we have achievements and challenges. So here we bring also more on what has already been achieved and what challenges were encountered in the process of achieving the particular goals and the possible recommendation for further actions. And then level 3, we have objectives and priority deliverables. So here we bring in the overall goals and objectives for the investment plan that we are coming up with. And then we check the outcomes for the delivery and the investment priorities that will be highlighted further. Level 4 or chapter 4 looks at resource implications, budget and financial gaps. So here we look at the resource requirements, available financing and financing gaps, resource mobilization strategies. We're literally like getting resources in place to see how the plan can be put in place. And the final bit of an investment plan is the implementation mechanism, which we talk about coordination framework, implementation capacity, and the monitoring of progress. So this is the summarized way of how an investment plan should look like, or the parts of an investment plan. So I want us to look at on this part one by one. However, I will not start with the first part because it's a bit straightforward, because there isn't much that is written there, apart from maybe a few description of the purpose, roles, and so on. So let's go straight and start with the second part, which is the situation assessment. So to first help us appreciate before we go to the situation assessment is that this lecture is geared towards Kenyans or Kenyan health workers who are in healthcare delivery systems or they're working as managers. So what happens is the strategic planning process in Kenya is actually guided by the planning unit investment plan, the planning units in the different level of leadership. And what the planning unit does is they come up with the investment priorities. And these investment priorities can be done at either county level or at the national level. So after these two categories of leadership or these categories of managers do, they develop the priorities or the investment priorities, then they come up with the medium term, priority focus areas. After that, now all these are put together into what we call the National Health Policy Framework. And the National Health Policy Framework is the long-term document that will be guiding the overall health objectives for the country. So working towards developing the National Health Policy Framework, that means you won't just have a framework that is lying there. It needs to be boosted up with other activities or inputs that will make it more sustainable. So for that purpose, after coming with the investment priorities, there's normally a development of the budget, which now is more of resource distribution or mobilization. And then we have the operational plans, which are the short-term activities and targets that the different levels can put in place. Could be the county level or the national levels put in place to achieve our national framework. And then at the end, after getting these short-term activities well outlined, there's now the performance contract or the performance targets that will be implemented at the different level. So this is a summary of how it all happens. There's a planning unit that comes up with a priority, either at the county or the national level. Then all this is now computed together to give us the National Health Policy Framework. And this National Health Policy Framework is now what will be focused on through budgeting, operational plans, and the performance contracts. So let's go straight now to the situation assessment. And we've said with situation assessment in the part of the investment plan is where we are checking on the population demographics. And we want to look at what is currently there in terms of populations. Where is the locations, age, characteristics, maybe in terms of gender or adulthood, elderly, and so on. Then in this, you want to check the health status and distribution. So this includes information on the current health status. For example, how much has already been invested in terms of health, what are already existing outcomes, what are the outputs and impact that are already on the ground pertaining to the health forecast that we are looking at. And the other part is the achievement and challenges. So as we are assessing the population, we are assessing the health status and distribution. We want to check the achievements. We want to see what has been achieved in regards to access and coverage. We want to look at what has been achieved in regards to building blocks. And building blocks of health work is the service delivery charters, the health workforce, medical products, health information, financing, leadership. All these are possible important areas that can be assessed. And the last part, after getting to assess all these areas, we can now come up and decide what are the recommendations for actions. And in recommendation for actions, we are relating this to the health outcomes, covering it from the different trends in terms of the health investments, access and coverage, the achievements and the challenges. So with situation assessment simply is a state where you're looking at the existing state that is in the population based on the different characteristics that you want to look at. Trends and distribution, achievement and challenges, and the recommendation that you would like to give as a planning unit in regards to the investment plan. Part 2 is on objectives, priority interventions, and processes. So at this level, what the planning unit will do is ensures that there's comprehensive set of objectives that are well defined and addressed. So here you have done the situation analysis, you've understood what is there, what was not done, what were the challenges and the recommendation you've put in place. So what you do at this level is you establish the set of objectives that you want to focus on in this new investment plan, and then there is now a recommendation that you need to address. So if you're recommending training for healthcare workers, how are you going to address that? And then you describe the inputs needed now to achieve the output. So if the recommendation is training of healthcare workforce, what are the inputs needed to achieve that? Do you give scholarship? Do you establish fellowships? Do you allow exchange programs? Are you planning to do, training on job trainings? these are inputs that need to be brought out at this level. And now you identify the relevant interventions that can be done to deliver the given inputs. So with the interventions, there is also need to define the deliverables. What will convince the team that the given objectives, recommendation, and inputs are being addressed? So there'll be the deliverables. So this will be looking at the quantifying of and time-bound focus for each intervention. And step 4 is, talking now about resource implications, budget, and financial gaps. So with this level, it's more so the most intense part, because looking for resources might a bit challenging for most systems or most planning unit. So what happened is, the first thing in this level is establishing resource requirements. So here we focus more on costing the processes to define what finances are needed to implement defined investment priorities from either previous sections. So you can use, let's say, previous investment and see what priorities were set there that you can also look into in this new investment plan. So you get to write down all the needed requirements, and then from there you establish the available financing. So you can mix and match the existing resources of the investment priorities, trying to understand what can come first and what is the available finances for each. And once done with understanding available financing, if there's enough, then you can mobilize the resources to see how you can address each needed objective. But if it's also not enough, then you can re-strategize and get new resource mobilization strategies to bring in more finances and to cater for financial gaps that will be a threat to the implementation of the investment plan. So looking at the available resources, you can have two types of available resources. We have the secured and the possible available resources. So with secured resources, these are resources that are implying about the government and non-partners that are already running programs. So for example, if you go to the Ministry of Health, there are certain programs that have already been budgeted for, and the financial sources are already there. So when you see such, this incurs or implies that already this is a secured resource, because the government has already allocated budget and fund for it. But on the other side, you can have probable resources or probable available resources, which means these are additional resources that you could be getting partners to add to the planning unit. So it is there but not yet secured. It could be maybe donor funding, it could be in form of grant allocations. So these are sources that are possibly can be incorporated into the planning unit but are not yet assured. So they are probable sources. And further addressing on the resources, so we've said once you've established available resources, you can now do resource mobilization, that is bringing in more sources that can be used to support the plan. So in the resource mobilization, for the secured resources, the best way to handle it is to adhere to the requirements for the sources of financing for planning and reporting. So for example, if the government has allocated a certain amount of money, for the purpose of secured resources, you're told the best way to access the finances is to adhere to the requirements. If it's needed as that we develop a budget for it to be approved and get the particular project funded from the secured sources, then that's what has to be done. So the main requirement for resource mobilization from secured sources is to have adherence or following the needed requirements for it. But on the other side, for probable resources, remember we are saying these are available sources, but they can only be sought after. And that means you need to look for them, either in form of grants or donor fund and such. So the best approach for getting probable resources is developmental of proposals. And with these proposals, you also have to adhere to the specific requirements by the required financial. So if it's a loan, then you need to fill up the specific requirements for accessing that particular loan. If it's a grant, then you need to understand the grant requirements and such. And once the mobilization has adequately been done, then we can talk about addressing any further existing funding gaps. So if there are other needed, funds that are not yet to be met, then you get to address that. And the last part is working around improving efficiency, that is shifting the funds to places that have great impact or maximizing on the use of the available funds. So you want to use that fund as effectively as possible to meet the investment plan that you're looking at. And the last part is on the implementation mechanism. So this is the approaches that can be used to ensure that the project can be implemented or the investment plan can be implemented. So we have the first part where we talk about coordination and government framework. So the coordination framework, what it will do, it will show partners that will be working with the planning unit and will be engaged in the planning in the investment plan. So with the coordination, you're looking at which other people are working with this particular investment plan. So if it's a plan covering healthcare services, then you look at which other partners can be working with us. Are they national, are they international organizations, or are they non-profit organizations? Bring that coordination framework to show who else will be part of this plan. And then the government structure and the implementation mechanism is how we bring in together to discuss who will be coordinating given parts of the plan. So this is looking at who are these people who will be part of the team that will be delivering certain units to the particular given plan. And the second part is implementation capacities. This is the different individuals or people who will be responsible for delivering different priorities. However, the responsibility focuses more on structures than the person. So if you're looking at implementation capacity, you can talk about if I have coordinating partners, what are their focus in terms of the health deliveries. So if you're looking at maternal and child health, you tell us who will be focusing on this. So is it an organization? So if you look talking of World Bank, so World Bank will be catering for which capacity? Will it be development of women health, or will they be coming up with preventive approaches, or will it be a funding agency, and so on? And lastly, after every implementation, it's good to have monitoring of progress. So with monitoring of progress, it will bring out how a plan will be monitored, but it will be targeting different indicators that have been put in the implementation plan or in the investment plan. So with this in mind, then at least you can understand the components of the investment plan. So thank you so much for staying with us to the end, and don't forget to subscribe, comment, and share our content, and give us an idea or more thoughts of where you feel we can discuss more and add knowledge to. Thank you and bye bye. See you in our next session.